Okay, so you're here because you want to understand things deeply, right?
Right. You don't want to just skim the surface.
Nope. We're going deep today. We're diving into Masyosha, the practice of Chinese medicine.
It's a really impressive book.
It is. I mean, it covers so much.
A lot of ground.
And it really gets into the heart of how TCM approaches health and healing.
Which can be really different from how we think about things in Western medicine.
Totally. So we're going to pull out some of those surprising insights, the things that make you go, huh, I never thought about it that way.
Yeah, like those aha moments.
Exactly.
Yeah.
And one of the things that makes this book so unique is how it brings together those core TCM principles like qi and blood, the 8 principles, 5 elements.
Functions of the internal organs.
All of that.
Yeah.
And it connects those with Western medical perspectives on the same conditions.
Which is so valuable because you're not just getting one side of the story.
Right. And it even highlights those red flags, the situations where it's crucial to seek help from a Western medical doctor.
Yeah, absolutely. Because sometimes you need that immediate intervention.
Exactly. So considering we're talking about over 50 different diseases and conditions, like thousands of pages.
We're talking a very thick book here.
We've narrowed it down to some really key points for our discussion today.
The most fascinating stuff.
Okay, let's jump right in. One of the first things that struck me when reading this book was how tricky it can be to translate TCM concepts into Western terms.
It's not just a simple word-for-word swap, is it?
Definitely not. The author actually calls it the fallacy of the perfect dictionary. It's like trying to capture the essence of a complex idea with a single word.
You inevitably lose some of the nuance.
And it's not just finding the right word. It's also about understanding the context, the way these terms are used.
A good example is Shen.
Shen, right? Depending on how it's used, it can mean so many things. Human spirituality, the divine, the mind, spirit, even the sparkle in someone's eyes.
Yeah, it's not as neatly compartmentalized as some of our Western terms. It's more like a spectrum of meaning.
And the author decided to go with translated terms for readability rather than sticking to pinyin, like Piangzu versus spleen-yang deficiency. I mean, which one makes more sense at first glance?
Definitely spleen-yang deficiency, especially for folks who aren't super familiar with TCM terminology.
Absolutely. And then there's the whole debate about using element for Ixing in the 5 elements theory.
Ah, yes. That's an ongoing conversation. Is element really the best fit?
It's interesting because the author actually brings in the historical context. So element, as we think of it now, is often tied to the periodic table, right? Those basic building blocks of matter.
But that wasn't its only meaning back in ancient Greece, where this concept originated in the West.
Exactly. So the author argues that element, with its broader historical connotations, isn't totally out of line with how Ixing is used in TCM.
And according to the book, there are several other potential translations for Ixing. Drawing on Wang Aihe's work, we have options like agents, entities, goings, even stages of change.
It really highlights the dynamic nature of the 5 elements, how they're not fixed categories, but more like interconnected processes.
It's about the relationships and interactions, not just static things.
Okay, let's switch gears a bit. We've talked about these foundational concepts, and now I want to talk about how they apply to specific health issues. So let's dive into abdominal masses.
Let's do it.
TCM looks at those so differently compared to Western medicine. So how does TCM generally categorize abdominal masses?
From a TCM perspective, abdominal masses usually develop because of a blockage or stagnation of qi, that's the body's vital energy, or blood stasis.
Blood stasis, meaning?
Meaning the blood isn't circulating as freely as it should be.
Ah, okay.
And sometimes phlegm can also be a factor.
Interesting. So it can be more than one thing.
It can be. But regardless of what's causing the blockage, there's almost always an underlying qi deficiency.
So it's not just something accumulating.
It's not just that. It's also about the body's overall energy being weakened, making it more susceptible to these blockages.
So how do you differentiate between these different types of masses when you're examining someone?
Well, palpation is key.
Meaning?
Meaning how the mass feels when you press on it.
Oh, I see.
Masses caused by qi stagnation tend to be more fleeting. They might come and go, shift position, even change location.
It's almost like a temporary snag in the flow of energy.
Exactly. Now, blood stasis masses, they're usually fixed in one spot, don't move around, and feel very hard to the touch.
And phlegm masses.
Those are also fixed, but they tend to be softer and usually don't cause pain.
So that gives you a starting point for figuring out what's going on. What about treatment? How does TCM approach that?
The general strategy really depends on how long the condition has been present.
Okay, so like different stages.
Yeah, think of it that way. In the early stages, the main focus is on building up the body's chi. You're strengthening the foundation.
So you're not necessarily attacking the mass directly right away.
Not at first. Moving qi and blood, resolving phlegm, those things take a secondary role initially. As the condition progresses, you start addressing both the underlying qi deficiency and the blockage at the same time.
A more balanced approach.
Right. And in the later stages, the emphasis shifts more towards getting rid of the blockage, but you're still supporting the qi throughout the process. It's always about having that underlying strength to support healing.
That makes sense. The book actually gives the example of a myoma, which is a uterine fibroid caused by blood stasis. And it mentions that even in the early stages, they might use herbs that both purify qi and blood, but also have a little something extra to start breaking up the stasis.
Right. It's like a gentle nudge in the right direction early on.
Yeah, exactly. Now, the book mentions some specific formulas like G, Ga, Ghu, Jukin, Mir Tang, and G, Ghi, Fu, Ling Wan.
Yes. Those are classic formulas for invigorating blood, breaking up stagnation, and helping to dissolve masses, particularly in the lower abdomen.
And it even gets into common modifications like adding Sanlang and Izu to enhance that mass dissolving action.
Or herbs like zibemu and bijia to soften hardened masses, which can be a crucial step in resolving them.
It's fascinating how each herb has these specific properties and actions.
It's like a highly specialized toolkit, with each herb serving a unique purpose.
There's a case history in the book, too, about a woman with endometriosis, an ovarian cyst, and a uterine myoma, all at the same time.
A very complex situation.
It was. And they diagnosed her with blood stasis, damp heat in the lower burner, and kidney deficiency.
Multiple layers of imbalance.
And the treatment approach was phased. First, to identify the overall condition, then address the endometriosis, and then work on shrinking the cyst.
They used variations of Ghi Ling Wan, often combined with Si Myo Tang, to clear the damp heat.
It even mentions other formulas like Biaze and Tang and Huajuan,
which are great for both strengthening qi and blood and working to dissolve masses.
Though there's an important note about the herb Yang Huang in a GA1.
Yes, Xianghuang can be toxic, so the book suggests a safer alternative.
Safety first, always. This really highlights the depth of knowledge within TCM.
It's not just about throwing herbs at a problem. It's about understanding their properties, their potential risks, and using them with precision.
Now, shifting to the Western perspective, abdominal masses can be caused by so many different things, right? Like aneurysms, enlarged organs, cysts,
fibroids, even just a buildup of stool. The causes are wide-ranging.
And the Western approach to diagnosis, treatment, and prognosis would vary dramatically depending on the cause.
Of course, it's a completely different framework.
TCM also makes a distinction in terms of prognosis between qi masses and blood stasis masses, right?
Right. Qi masses are often seen as easier to disperse. Sometimes they even respond well to acupuncture alone.
Really?
Yes. Blood masses, on the other hand, usually require the stronger action of herbal medicine.
Interesting. So location also plays a role in Western diagnosis, doesn't it?
Absolutely. A mass in a specific area can point towards certain organs or systems being involved.
Like the book mentioned, a mass in the right upper quadrant often points towards the liver or gallbladder from a Western perspective.
Exactly.
Okay, so we've talked about the physical aspects of these conditions, but TCM doesn't stop there, right? It also recognizes the powerful influence of emotions, particularly in abdominal pain.
That's a connection that often gets overlooked in Western medicine.
It's like, oh, you have a stomachache, here's a pill.
Exactly. But TCM takes a much deeper look at the root causes.
So how does TCM view that mind-body connection when it comes to abdominal pain?
It places a lot of emphasis on the role of emotional stress, especially anger.
Anger meaning?
Well, it's more than just outright rage. It encompasses frustration, resentment, irritability, that whole spectrum.
Oh, okay.
And those emotions, particularly when they're bottled up or unexpressed, can cause qi to stagnate, especially in the liver.
And because the liver channel flows through the abdomen.
Exactly. That liver qi stagnation can directly lead to abdominal pain, bloating, discomfort.
It's almost like our emotional state is imprinted on our gut.
In a way, it is. The book has a great case history about this. A woman came in with severe abdominal pain and her tongue was purplish.
Purple, huh?
Yes, a classic sign of blood stasis. So the first practitioner focused on invigorating her blood, which helped a bit. But then a more experienced teacher examined her and noticed something interesting. She actually felt better when pressure was applied to her abdomen.
That's unusual.
It is. And her pulse was very fine and weak.
So two seemingly contradictory things.
Right. The pain and purple tongue pointed to fullness, like blood stasis, but the relief from pressure and weak pulse suggested an underlying emptiness.
So what do they do?
The experienced teacher adjusted the treatment. Instead of focusing solely on invigorating blood, they prioritized to quantifying qi in blood with only a mild emphasis on moving blood.
That's amazing. Just by paying attention to those subtle details.
Exactly. It's a perfect example of how TCM looks at the whole picture.
It's not just about treating the symptom, but understanding the underlying imbalance that's driving it.
Ex-
Now, let's talk about pulse diagnosis.
Boom.
It's such a fundamental part of TCM, and it can actually tell us a lot about what's happening in the intestines, right?
It can. By feeling the pulse at different positions on the wrist, a skilled practitioner can glean insights into the state of qi, blood, and the internal organs.
It's amazing how much information is contained in the pulse.
It is. For example, a tight and slow pulse in the deeper positions often indicates cold in the intestines.
Cold, like feeling chilled.
Yes, and also like slowed digestion, sluggishness, that kind of thing.
Okay.
A wiry pulse often suggests stagnation of qi or blood, and if it's wiry, rapid, and slippery, that can point to damp heat and potentially even bleeding in the intestines.
Wow. Serious stuff.
It can be.
Yeah.
A wiry and hollow pulse could suggest chronic blood loss, while a rapid and slightly hollow pulse might indicate a risk of impending bleeding.
That's incredible, just on the pulse.
The pulse can reveal a lot.
So let's say someone is experiencing abdominal pain or other intestinal issues. What are some of the acupuncture points and herbal strategies that might be used?
Well, there are specific points that have an affinity for the abdomen.
Like?
Triple burner 6 or TB6 is often used to get qi moving smoothly throughout the abdomen.
Okay. What about liver qi stagnation?
For that, gallbladder 34, especially when combined with conception vessel 6, is very effective for moving liver qi in the lower abdomen.
Okay, and what about points for pain relief?
Liver 3 and bladder 18 are great for moving liver qi, stopping pain, and also calming the mind.
Multi-purpose points.
They are. Spleen 6 is another one that can soothe the liver, relieve abdominal pain, and calm the mind.
Lots of options for calming the mind. Sounds like a good thing for all of us. What if someone has dampness?
If dampness is a problem, you might use points like conception vessel 9, spleen 9, stomach 28, and bladder 22.
Got it. And for lower abdominal pain specifically?
Stomach 39 is a good one for that.
Yeah.
And for pain and also dissolving masses, there's conception vessel 3, conception vessel 4, stomach 25, spleen 15, and stomach 29.
Wow, that's a lot of points.
It is. And we haven't even gotten to the points for invigorating blood.
Oh, right, the blood. Tell me about those.
Spleen 10 and bladder 17 are commonly used for that. And spleen 4 and pericardium 6 are particularly powerful because they influence what's called the penetrating vessel,
Which is also known as
the sea of blood.
dramatic.
Right.
So tell me about the herbal remedies that are often used for these issues.
Okay, so some commonly used formulas include SIMO Tang variation, which is great for resolving dampness and moving qi in the lower abdomen.
Okay. Anything else?
SHAO FUZHUYU Tang is a warming formula that's used for cold, blood stasis, and pain in the lower burner.
And if someone's constipated?
FU1U SEA Tang can be helpful because it invigorates blood in the lower abdomen.
And the book mentions that these formulas can be modified.
Yes, like you can add Huang Qi to SHAO FUZHUYU Tang if there's also a Qi deficiency.
Or Baizu and Fuling for dampness.
Exactly. It's all about tailoring the formula to the individual's specific needs.
That's what I love about TCM. It's so personalized. It's not just a one-size-fits-all approach.
Exactly. And speaking of personalized, the book also talks about the common pattern of spleen qi deficiency with dampness.
What are the signs of that?
Well, you might see dull abdominal pain that comes and goes, fatigue, loose stools.
Sounds familiar. So how do you treat that?
The focus is on tonifying spleen qi and resolving dampness, and there are specific acupuncture points that can help with that.
Very cool.
Oh, and there's something else I wanted to mention. A clinical study that used herbal blasters on the belly button to treat abdominal pain in kids.
On the belly button.
Yep.
Yeah.
It's a really gentle, non-invasive approach.
What herbs were in the plaster?
Let me see. Guya, Shanza, Jinaijin, and Yanhusuo.
Interesting. And so TCM doesn't just focus on abdominal pain, right? The book talks about pain in other parts of the body, too.
Right. There's a whole category called bisyndrome, which includes things like arthritis and muscle aches.
So how is that treated?
It depends on the underlying imbalance.
You mean example?
Okay, so if the pain is chronic and associated with yin deficiency, like you might see in older folks, the focus is on nourishing the root and dispelling wind.
Okay. What about acute pain?
If there's acute pain with red swollen joints, that's often due to damp heat, so you'd clear that from the channels.
And what about chronic stubborn pain, like in rheumatoid arthritis?
For that, you'd want to benefit and strengthen the sinews and connective tissues because there's likely phlegm and blood stasis.
So many variations.
There are. And the book also categorizes different 3 treasures formulas based on the organ systems they target for pain.
Like formulas for heart pain, liver pain.
Stomach and spleen pain.
So many possibilities.
Right. So for pain from liver key stagnation, you might use a formula called release constraint.
Okay. What if there's liver key stagnation and spleen key deficiency?
Then smooth passage could be appropriate.
I love those names. What about lower abdominal pain from blood stasis?
There's a great formula for that called stir field of elixir. And for dull epigastric pain from spleen qi and stomach yin deficiency, central mansion is often used.
Those names are so descriptive. It's like poetry.
It is. And speaking of descriptions, the book also differentiates between fullness and distension.
Those sound pretty similar.
They do, but in TCM, fullness often indicates something more substantial, like undigested food or dampness. When you palpate the area, it feels hard, but not necessarily elastic.
Okay, what about distension?
Distension is more of a subjective feeling of being bloated or swollen, often due to stagnant qi.
Got it.
It's all about those subtle distinctions.
Now, when we talk about abdominal pain, we can't forget those Western medical conditions, right?
Absolutely not.
Things like kidney stones, appendicitis, issues with the intestines.
And the book specifically mentions pyelonephritis, a Western medical term for kidney infection, as a potential cause of kidney pain.
Right. And the book also talks about GERD, or gastroesophageal reflux, from both a Western and TCM perspective.
Yes. And what's interesting is how TCM differentiates between various types of digestive upset.
Like?
Well, there's hiccup, which is called yi ni in Chinese medicine.
Okay. What else?
Then there's sour regurgitation, which is called tun suan, and sour vomiting, which is tu suan.
It's amazing how much detail TCM goes into. It's not just, oh, my stomach hurts.
Exactly. It's about really understanding the nuances of what's happening.
So how does TCM approach DRD?
Well, it looks at factors like diet. For instance, eating too many greasy, fried, or dairy foods can lead to dampness and phlegm.
Oh, yeah. I can feel that happening already.
Right, and cold foods can damage the stomach T.
So just like with abdominal masses, there are full and empty patterns in core,
Yeah,
right?
yes. Fullness, like key stagnation, blood stasis, or phlegm, tends to be more common in the early stages. But over time, emptiness, like qi, yang, or yin deficiency, might become more prominent.
That makes sense. So tell me about one of the full patterns.
Okay, there's a common pattern called qi stagnation with phlegm. You might see acid regurgitation, difficulty swallowing, a feeling of a lump in the throat, nausea, and a thick, greasy coating on the tongue.
And what are some of the treatment strategies for that?
Acupuncture can be helpful, targeting specific points to move qi and resolve phlegm.
Okay, and herbs?
There's a formula called QIGES that's often used, and also a 3 treasures formula called Bright Spirit.
Got it. So what about stomach yin deficiency? What does that look like?
One of the key signs is a tongue that lacks a coating. It might also be red, which indicates what we call empty heat.
Okay, so moving on, let's talk about allergic rhinitis.
Allergic rhinitis, or what we in TCM often call baiyuan, which translates to stuffy nose.
Right. So how does the Western perspective on allergic rhinitis compare to the TCM view?
Well, Western medicine focuses on the allergic reaction. You've got an allergen that triggers inflammation and leads to those classic symptoms: sneezing, runny nose, itchy eyes.
All the fun stuff.
Right. But in TCM, we don't necessarily focus on the allergen itself. We look at the patterns of imbalance that are creating that stuffy nose.
Okay, give me some examples of those patterns.
One common pattern is the lungs being invaded by wind cold or wind heat. You also see patterns like liver and gallbladder heat, lung heat, or even heat originating from the stomach and spleen.
So it's a very different way of looking at it.
It is. The book even mentions that most Baiyuan patterns, except for the wind-cold invasion pattern, often look like what Western medicine would call sinusitis.
Interesting. And speaking of research, the book mentions a clinical trial that looked at acupuncture for allergic rhinitis.
Oh, yeah. They compared real acupuncture to sham acupuncture in kids with persistent allergic rhinitis. Always good to see TCM being studied.
Definitely.
Oh.
Now let's wrap up with anxiety.
Okay, anxiety.
Such a prevalent issue these days. So what are some of the TCM perspectives on anxiety?
Well, in Chinese medicine, we have specific disease entities that correspond to anxiety.
Like what?
One is rebellious qi of the penetrating vessel,
Which is also known as?
the Chongmai.
Right, the Chongmai.
And then there's also the distinction between mind unsettled and mind obstructed. These are different ways that the heart, which houses the mind in TCM, can become imbalanced.
Got it. So tell me about rebellious qi of Chongmai. What causes that?
It can be triggered by a number of things, like emotional stress, a person's constitution, diet, blood loss, or even just overwork.
So it can be pretty multifaceted.
It can. And the treatment often focuses on balancing the heart, lungs, kidneys, spleen, and liver.
Makes sense.
The book even includes quotes from ancient TCM texts that talk about how blood deficiency and yin deficiency can contribute to anxiety symptoms.
And like what?
One quote from Zhu Zinheng talks about how blood deficiency can lead to fear, palpitations, and what he calls panic throbbing.
Panic throbbing. What's that?
He describes it as a kind of constant anxiety with a feeling of the heart pounding or shaking. It's often associated with worry, pensiveness, and phlegm heat.
Wow. So vivid. Any other quotes?
Yes. Zhang Jibin, another famous physician, talked about panic throbbing as well, describing it as the heart shaking from fear and anxiety. He linked it to yin deficiency and qi not returning to its origin.
Fascinating.
Right. These ancient doctors really had a deep understanding of these subtle energetic disturbances.
It's amazing how relevant those insights still are today.
Absolutely.
Okay, so back to Chongmai. You mentioned different types, right?
Right. There's primary rebellious qi of Chongmai, which is usually triggered directly by emotional stress. And then there's secondary rebellious qi, which is often seen in women and is more related to deficiency, especially in the lower abdomen, blood, or kidneys.
Okay, that makes sense.
And it's important to note that anxiety in TCM isn't just limited to fear. It can also be brought on by worry, excessive joy, shock, guilt, shame, or even too much contemplation or thinking.
All those different shades of unease.
Exactly. And there's this interesting physician named Wang Qinren who believed that blood stasis was a primary cause of anxiety.
Blood stasis and anxiety. How are those connected?
He believed that stagnant blood could block the flow of qi and disrupt the heart's function, leading to anxiety. And he even created a famous formula called Shufuzu Yu Tang to address it.
Fascinating. So tell me more about heart blood deficiency and anxiety.
Okay, so with heart blood deficiency, you might see palpitations, poor memory, insomnia, a pale complexion, and of course, anxiety.
So many overlapping symptoms. How do you treat heart blood deficiency?
We have lots of tools. Acupuncture can be very helpful, as can herbal formulas like Jui, Pi, Tang, variation.
Okay, and is there a three treasures formula for that as well?
There is. It's called Calm the Shen.
I love that. So simple and direct.
Yeah.
So any interesting case histories about anxiety?
The book mentions a woman with daytime anxiety who was also overweight, always felt cold, had lower backache and dizziness, frequent pale urination, and a pale, weak, deep pulse.
So many different symptoms. What was going on with her?
From a TCM perspective, it looked like she might have been overworking, which depleted her kidney energy. That, in turn, could have contributed to all those other symptoms, including her anxiety.
It's amazing how everything is connected.
It really is.
Well, this has been an incredible deep dive. We barely scratched the surface of this book, but I feel like we've gained so many insights.
It's amazing how much TCM offers, isn't it?
It is. It's a whole different way of looking at the body, health, and even what it means to be human.
I think what's most fascinating is that TCM offers both a distinct and sometimes complementary perspective to Western medicine.
Right. It's not about one being right and the other wrong. It's about recognizing that they both have valuable insights to offer.
Exactly. And hopefully this discussion has sparked some curiosity in you, our listener.
Yes. If you're interested in learning more about TCM and how it might apply to your own life, we encourage you to explore these topics further.
Maybe even pick up the book. It's well worth the read.
Absolutely. You might be surprised by what you discover.
I think you will.
Thanks for joining us on this deep dive. Until next time.
See you then.